Assalamu alaikum. Dear colleagues and students, I will try to give you some important point about the classification system for periodontal diseases and condition. All, the first question came to our mind why we should study the classification of periodontal disease. You know that the classification is necessary to separate a disease into a separate condition and into a distinct categories. So it will aid to appropriate clinical and laboratory diagnosis and specific treatment. Without a classification, we cannot do appropriate or a specific treatment. The classification system should be depend on the etiology, histopathology, where appropriate, genetic, rather than the onset of disease or the rate of the progression. Over the last 3 decades, several classification attempts have been made to classify the periodontal disease. A major changes was introduced in the classification of periodontal disease in 1999 as there was introduction of the gingival disease that was not previously introduced in other classification. Also, periodontitis were classified into a chronic periodontitis and aggressive periodontitis in addition to periodontitis as a manifestation of systemic diseases. In 2017, periodontal disease were classified again to a major and important classification system with several differences between this classification and the previous classification systems. The most important difference was introduction of periodontal health in addition to the gingival diseases and condition which was not previously introduced. So the studying of periodontal health is important so that we can differentiate between the health and disease. In addition to that, the term of chronic periodontitis and aggressive periodontitis in this classification system was termed just a periodontitis, since there was no difference between the two diseases in a systematic review done for both diseases, in addition to the involvement of necrotizing periodontal disease and periodontitis as a manifestation of systemic. In addition to that, the classification of 2017 including other conditions affecting the periodontium, and this involved the systemic disease and condition affecting the periodontal tissue, periodontal abscess and endodontic lesion. Also, there is a mucogingival deformity and condition, a traumatic occlusal force, in addition to tooth and prosthetic related factors. Also, in this classification system, a major change was introduced as there was a classification of peri-implant disease and condition. It was classified into peri-implant health, peri-implant mucositis, peri-implantitis, peri-implant soft and hard tissue deficiencies. All these point was not studied in the previous classifications system. We will start with studying the periodontal health and gingival disease and condition. The gingival health or periodontal health can be defined by the absence of any clinically detectable inflammation, as there is a biologic surveillance between the immune system of the gingival tissue and dental plaque. The clinical gingival health can be restored after treatment of gingivitis or periodontitis. However, the treated and stable periodontitis can have a high risk for development of recurrent periodontitis. Clinical gingival health can be classified into a clinical gingival health on an intact periodontium and clinical gingival health on reduced periodontium that include stable periodontitis patient and non-periodontitis patient. And based on available method to assess the gingival health and inflammation simply, objectively and accurately by using a bleeding on propping score, assessed as the proportion of a bleeding site were stimulated by a standardized periodontal probe with a controlled force to the apical end of the sulcus. يعني نجيب البريودونتال بروب نمشيه على الجنجافال sulcus all around the teeth and we give score 0 for non-bleeding site while score 1 for bleeding site, and we calculate the percentage of bleeding on propping to know whether the gingiva in a healthy state or in a disease state. And to know the criteria of the clinical gingival health on intact periodontium, first we must know what is the meaning of intact periodontium. That is mean that there is no destruction in the gingival tissue or supporting apparatus of the teeth, no loss of attachment, no alveolar bone destruction, and the gingiva attached to the tooth at junctional epithelia with a junctional epithelia at a cemento-enamel junction. The criteria of a clinical gingival health on intact periodontium characterized by absence of bleeding on propping or less than 10% with a propping pocket depth equal or less to 3 mm are the major characteristic of a clinical gingival health on intact periodontium. طبعا أنا خليت لكم هذه الصورة حتى توضح لكم اللي على اليمين حتى توضح لكم البروبنج بوكيت ديبث شلون أقيسه، مع أنه هذه الصورة ما تمثل لنا الكلينيكال جنجافال هيلث بس تمثل لنا الانترست مال البريودونتال بروب to the base of the pocket or base of the sulcus to measure the distance from the base of the sulcus or base of the pocket to the until the gingival margin. This means the propping pocket depth. Assessment of propping pocket depth, which should be 3 mm or less, with bleeding on propping percentage, which should be less than 10%, with the absence of patient symptom and absence of loss of attachment, will indicate that there is a clinical gingival health on intact periodontium. As we finish the characteristic of a clinical gingival health on intact periodontium, now we came to the characteristics of a clinical gingival health on a reduced periodontium, which that include two parts. First of all, non-periodontitis patient. A non-periodontitis patient means that there is a destruction in the attachment apparatus of the teeth due to a procedures rather than periodontitis. That is mean, as we see in this picture, there was a destruction in the attachment apparatus of canine and a premolar due to a forceful or faulty toothbrushing technique and formation of gingival recession. Also, destruction could be due to orthodontic appliance or after a crown lengthening procedure in non-periodontitis patient. The clinical gingival health have a criteria for those people similar to the criteria of intact periodontium. The major difference was approping attachment loss is found in those patients, while there is no attachment loss in a clinical gingival health with intact periodontium, also with a possible radiological bone loss, while the propping pocket depth and bleeding on propping have the same criteria for both intact periodontium and non-periodontitis patient. Finally, we will start a discussion of clinical gingival health on stable periodontitis. First, we must know what is the meaning of stable periodontitis. Stable periodontitis means successfully treated periodontitis patient. The clinical gingival health for those patients have several criteria, including surely the presence of attachment loss and radiological bone loss, with a bleeding on propping percentage less than 10%. Also, the propping pocket depth will be less or equal to 4 mm, supposing that no bleeding on propping site at a pocket measured 4 mm. So, the clinical gingival health found in 3 criteria. First, in intact periodontium. Second, on reduced periodontium in non-periodontitis patient. And third, in reduced periodontium with stable periodontitis.